Hello, my name is Robert Meredith Jr. I'm doing a PowerPoint presentation on interventional radiology, the interventional part of it, and for Emory University. And to start out, first off, I want to thank my parents and my sister for filming me. Yay!
Yeah.
And I got some sound right here. Well, I had sound, but don't worry about it. So we're gonna begin with what is interventional radiology. Cause I'm assuming you guys don't really know what's going on with that. My mom might do a little bit, my dad do, cause she had some issues back in her illness time. But so we're gonna start out with what's interventional radiology. Interventional radiology is a special field within radiology. It is where interventional radiologists perform minimally invasive surgical procedures through small incisions through the body. And that means like when you get stents put in your body, catheters, different kind of ailments. And the reason why interventional is so important because it's a different way of doing something besides going to surgery. Because a lot of times when you do interventional, it's less invasive. Therefore, your time of recovery is better, your illness is better, you just overall is better. And like I said before, interventional radiologists perform minimally invasive surgical procedures through the body through small incisions. And here are some of the examples of interventional procedures. Angioplasty, that's where you repair unblocked blood vessels. Stenting, when you put small tubes through the narrow arteries to open them up. Thrombolysis, when you're dislodging blood clots. Embolization is when you're unblocking blood flow due to cancer. And you have biopsies. And we're going to give a brief history of interventional radiology. Interventional radiology first began in the early 1920s. And back in 1953, Dr. Sarah Diener, he paved the way for interventional. In 1963, Dr. Potter first brought the idea of interventional radiology through an accidental operation. And I have some notes here. Also, I already talked about the biopsies, which is when you pull skin tissue for treatment to make sure you don't have any cancer or anything. So we're gonna go to the next slide here. Okay, this is when we talk about the stenting portion. And this is an illustration of the stents going through the body. This is when you have plaque or a buildup in your arteries and that blocked fatty plaque. And that's the picture of the stent where it opens up and it balloons and actually clears the vessels. And then the stent stays placed and the wire comes out and the blood flow is restored from there. And that's pretty much how stenting works. And that's pretty much called an angioplasty when you're going and unclogging the blood vessels. And like I said, the balloon goes through there, which was invented in 1986. In 1990, that's when the metal stents came present. And today we have all different kinds of stents. We have plastic ones, retractable ones, grafts, all different kinds. And they're used in advanced forms of vascular radiology. And like I said before, this is really important to me because my mom, when she broke her leg, and that was in July, she had, anyone that goes from surgery, they down for a long time not moving, and your blood clots start from not moving. When you're not moving your lower body, you're sitting in one place, your body pools blood, and that comes from blood, that draws blood clots. And she ended up with blood clots, and she had to get a lot of stuff done. And this is part of what she got done when they put a stent in, and they go through the femoral artery, and they pretty much try to clear the area, and then they use another medication called heparin, where they pretty much flush out the blood and flush out the clots. Let's get to the next slide here. Okay, this is talking about just the timeline of how intervention progressed. Like I talked about in the 60s when we started out with the percutaneous treatments, and then in the 70s with the angioplasty I showed you a minute ago, the balloon grafts, and then the 90s with the new stents we have now. It is showing the illustration of how over the years, interventional became really important to the field of radiology. Okay, this is an illustration of the blood vessels throughout the hand and the vascular work up through the hand. And throughout your body, you have millions of arteries and veins, and without those being open, you will lose felt in your hand. You see how these vessels are darker now, and these right here are lighter. So therefore, the vessels are not flowing blood through the tip of the fingers, and therefore they have issues. So that's interventional comes into place when they will come in and open these vessels up to allow the flow through the hand. And this slide right here is just showing the tools of interventional. You have needles. The needles are for the access to the veins and used for injection, for the biopsies, for aspirations. You have wires. They're for access also, and they also help steer the catheters through the veins to get the point where they get to. Then you have the catheters, of course, and the catheters for access, draining, ballooning, stenting, all the other stuff. And this is talking about the evolution of radiology. Like I said, radiology's been around for a long time, almost a century ago. And radiology also uses diagnostic tools like X-ray, fluoroscopy, ultrasound, MRI to help with their procedures. And like I said before, interventional at the beginning was just known as like special procedures and just angioplasty where you deal with blood vessels. Now interventional goes from biopsies to stenting to a million different things. So interventional is a whole different modality by itself now. It's not just specialist anymore. And some more advancements over the past 50 years, the field has really progressed. You know, interventional tools, where existing tools or new tools are developed to help the clinical situation. And most of the doctors that was forefront in interventional, they're real creative. That's why creativity is a big goal with interventional. And new procedures now are much better than old procedures. I'll go back to that real quick. And that is a picture of, like I was saying before, this is a stent right here, a metal stent, and that's your guide wire. I was talking about the guide wires earlier. The guide wire helps guide the stent in place, and then you pull the guide wire and the stent stays put. Mm-hmm. And also, this is a pretty much a exam of the kidneys, because that's your kidneys right there. And they probably had some blocks in the kidney area, and they put that in and open up the blood flow and the flow of the kidneys.
That's a kidney?
Oh, right here, yes ma'am.
Oh, that's okay.
Right here.
This is obvious.
That's kidney right there. That's kidneys right there.
Oh, okay. I said that.
Yeah, that's kidney right
like
there.
A bone.
Right, that's kidney. That's your bone. That's your staph spine. That's
Okay.
kidneys right there. Yep.
Sorry. Right.
And we talked about different procedures and treatments. We talked about the angiograms, the arteriograms. You have blocks in your arteries. The percutaneous angioplasty. That's when you have arterial disease, like you have a bunch of plaque in your arteries build up. Mm-hmm. Individuals can also do heart issues, like they have vascular interventions for catheters for your heart. Interventional could be a different many things you can do. Also, you have non-vascular interventional procedures. That was like the one we seen a minute ago, the percutaneous nephrostomy. That's when they was doing something to the kidney area. And also you can have abscess removal, like you have an abscess, they can remove small abscess, small tumors. And over the years, the tools have really perfected. Like I talked about earlier, you have a million different types of catheters. You have a lot of different types of catheters. They're made out of different kind of polyurethane, Teflon, nylon. They have different kind of ways they bend. They call pigtail tips. Different kind of ways they bend, different sizes, different shapes. There's all different kind of catheters.
How would you know which one is best to use for the procedure for the patient in reference to all those different?
According to what you're trying to get, like if you're trying to get, say you're trying to get to the femoral artery, say you're trying to get up the body, mm-hmm. You want to use one that's not as curved, more straighter. Okay. And say you're trying to get somewhere like towards the middle of the body, you might use one curved to get around the body. Cause the body has different vessels that flow all around each other. So depending on the area of anatomy you're trying to get to, the point of interest, you use the cavernous cord.
Okay.
And let's talk about the tools again. This is an example of a sterile tray. They open up, they were doing a catheter procedure. That's your catheters, and these are called dilators, and different part apparatus go to the catheter. All it goes together, and it goes in the body, and then you pull it out like mom has. A sheet it pulls out. When they get it all together at the end, when they get what they want, all this comes back out.
So when will you use, I know that all those tools is IR tools. When will you use, say for instance, like the balloon?
The balloon will be for,
procedure called?
the balloon will be like earlier I showed you the stemming. Like say you got a blocked blood vessel, you got a lot of people have like plaque build up from high cholesterol. The balloon be more for that. You open the blood vessel and it blows it up, open it up. Also you can use balloon if you got a blocked artery. Like you got a blocked artery down here, you can put it in the femoral artery and you can blow it up. Like mom had one. She got stent now in her leg, in her lower leg, yeah.
And it keeps the drain. Okay.
Yeah, keeps the blood flow, yeah. And what it does, like the picture I showed you earlier, I'll show you when you get finished, it opens it up and it stays in there. The stent stays in there. The balloon goes out once it opens. It's called a dilated balloon.
Now, which one is the safest to use? I know those wires, there's been some medical concerns about the wire ones here lately, so.
Talking about the IVC filters, not
Yes,
on TV.
yes,
They
yes.
They're pretty much outsourcing. I'm not a doctor, but from my knowledge, they're pretty much outsourcing the IVC filters now. They're not really using it, so it's pretty much.
So they're going away with the wires?
Yeah.
Okay.
Not wires, but it's like IVC filters.
Okay.
That's different. IVC filter is more wires. A guide wire is different IVC filter.
Okay.
Yeah. And this is just showing how in the years how intervention is gonna start really growing. It's a pie chart, and the green showing the angioplasty with the block artery we talked about earlier. The biopsies is right there, the drainage, the embolism is right here, and the catheters are right there. It is showing how interventional in the next 6-7 years is gonna really progress. Now, next 4 years.
So the green, so it seems like the green is more popular.
The angioplasty, that's when you got blocked blood vessels and all that.
Oh, okay, okay.
And it comes from, like I said again, the cholesterol. And like I said before, intervention was once only viewed as only angiography. Now it has all different kinds of special procedures. And now interventional radiologist does everything. They're responsible for coming to see the patient, making rounds, admitting the patient to the hospital, doing the procedure and everything. They're like a regular doctor now.
So they broaden the functionality.
Yeah.
They know, okay.
Yeah, it's a much broader horizon now. You know, and now IR is pretty much known as a dedicated specialist, like X-ray, ultrasound. It's a dedicated modality now. You know, X-ray has a field of modalities. You have X-ray, ultrasound, MRI. Now, IR is one of those modalities by itself. A long time ago, before I got in the field, it was called specials. Now it's called interventional radiology. So it's a whole subspecialty by itself within radiology.
So do you think maybe in the next couple of years in reference to the I know MRI, that they're going to probably find a more advanced way of doing the MRI? Because
Well,
now
MRI and IR is different.
Oh, okay.
MRI is medical, it's magnet based. MRI is more of a magnet based when you just using a magnet to get your image, and IR is more radiation based where you're using radiation to get an image. So it's totally different. It's two different subspecialties.
Gotcha.
MRI would be more for tissue anatomy, bone anatomy, and it's more clear for that. IR is more for the passage of vessels through the body and blockage in the body. And like I said earlier, this is my picture of a interventional radiologist, and this is another pie graph of the market share, how it's going to grow over years. And once again, this has your ultrasound. It's showing the whole modalities pretty much. Ultrasound, MRI, X-ray. Ultrasound is big right now, and then fluoro is your green right there. The box is red. The angio is purple, and then the other orders is the big one. That's like X-ray and operator orders. And we're gonna go back to that slide to show you the one about the stents. Any questions?
why you can't take no x-rays after 6 months, after you have it.
The stent?
No,
Well, my x-rays and basic x-ray are two different things once again.
Yes, exactly.
X-ray is your basic modality, is diagnostic x-ray, and then interventional is a more advanced subspecialty x-ray.
because they use contrast.
Yeah, and interventional uses contrast, but x-ray, you very rarely use contrast, unless
Okay.
you're doing a certain procedure.
Okay.
You would just have with a hand. then.
I'm going back to the
What the contrast do, help you see better?
The contrast helps visualize the area inches more. Yeah, that's the purpose of it. Contrast is radio opaque, therefore it's a dense material and it shows up on x-ray better
Yeah.
and interventional better. Like we said a minute ago, Ms. LaWanda, this is talking about the stents. This is a blocked artery or blocked vein.
Your mama
And
got mom.
the yellow stuff is your plaque. Like you have a bit of a plaque, so you got a blocked vessel. And the stent goes in and then it balloons up. That's the balloon right there. And it opens up, it's called dilated balloon. It opens up the blood vessel. See how it's small and it's big now. And then once they like time it, they open it up and kind of time it for some minutes and then take it out and leave the stent in. And the stent stays in. Some of them could be like 8 months, some be like a year, it stays in, and then the blood flow's restored from that.
So how often do you have to go in and they have to redo that? How often?
It depends, like I said, from 8 months. Some people do, I've seen some they have temporary stents, like 3 months or 6 weeks. They have some that's a little bit longer. They have some that can stay in. I think the metal stents are the longest, but like I said, the metal ones are pretty much they're not using much anymore. The metal's starting to phase out in certain procedures, but
You can't have no
it could be 6 months to, it could be different times. And you asked about the hand also? Let's see about the hand again.
You want the hand stent.
Okay.
Like you see, okay, on that,
I ain't
On
got
the,
nothing with my fingers.
where there is
My
no-
blood ain't
where there is
running
no-
through.
the
There ain't
veins
no
right
blood
there,
circulation.
that's lost. That right there, that's numbness in that person.
Well, that's
why
not
I know
numbness. That's just a restricted flow. It's like it's not flowing. Your vessel's not flowing. And like Mom said earlier, they probably had contrast shot in their body, and that's making it darker. That's why the vessels are darker. They won't show up like that unless they
Yeah,
have contrast
sure
in
will.
it. So that's contrast shooting
Maybe
the
it's
body,
visible.
and that right there is showing the area where it's not your blood vessels. Your circulation is not flowing. So that would be like you might have some number
I
tingling, but
got
there's no guarantee what you have. But there's some issue. It's called some issue of stricture that's right there. Yes.
Y'all use y'all don't use the contrast.
Yes, ma'am.
Oh,
Yeah, X-ray use contrast, ultrasound use contrast, MRI use contrast, not ultrasound, X-ray,
MRI.
MRI use contrast also.
Oh yeah, we on the shop.
They have selenium, they have contrast also. CT has contrast, ultrasound use contrast, but yeah, it's contrast. Any more questions?
Where do you see this field going within the next, say, for instance, the next 10 to 20 years? Where do you see this field going?
I don't know for sure. I'm not a.
I mean, just from your
I
perspective.
think over the last 20 years, it done already emerged so much. So I think right now it's gonna level off a little bit, but it's gonna get more busy. Like I know, due to our eating habits and the lifestyle that we live in America, we eat all this junk food and fast food and not healthy. People are gonna have cholesterol issues, high blood pressure. Therefore, you're gonna have necrosis of the veins of your legs. You're gonna have blood vessel issues. You're gonna have clogged artery, blocked arteries. You're gonna have a heart issue where you get stents in your heart. There's always gonna be a need for these procedures. Like I said earlier, interventional is less invasive than going to regular surgery. Therefore, you can get it and be in and out and not have to be down as long and recover as long. So it's gonna be a need for. It's gonna grow. That's why I want to be in the field. It's gonna grow. So I don't know how much. It's gonna grow a lot. You know, so that's my opinion. My opinion.
Okay.
Any more questions?
No, thank you, Mr. Meredith, for sharing this information with us.
Thank you guys so
Very
much.
informative.
I love my family.
We love you.
Yeah.
Yeah.